Director Hundrup, I'm going to pick up right where we left off. Solid Start is working better, more effective outreach strategy than In Transition for connecting with new veterans in need of mental health services. The question when we last spoke was why? Specifically, what about Solid Start makes it work better?
Thank you for the question. I think what it boils down to is the level of effort. For example, as my fellow panelists stated, Solid Start sends an advance email, a packet of information, and will call a veteran up to 7 times at each touch point, which is at 3 different points across a 1-year period. Contrast to that to In Transition. In Transition will make up to 3 phone calls, but actually the reality is, depending on demand and the resources, they're really only making 1 or 2 phone calls, depending on the month. And so if they don't make contact, they will then remove the individual from the program if they're unsuccessful in contacting them. So these folks are removed or unenrolled after only 1 or 2 attempts, which is, I think, behind the very abysmal rate that we're seeing in terms of the ability for folks to even know about or participate in the In Transition program. Very quickly, I would just note that we are seeing some overlap across the 2 programs, and particularly that's coming out with the fact that they're identifying the same individuals when it comes to the priority list for the Solid Start as well as the In Transition list. They're calling them via telephone during the same period, which we have heard can be confusing, especially for those that may not understand the programs or determine which one is best. So they're getting a lot of phone calls during a very specific period of time. So, we note that overlap sometimes is warranted. Perhaps that allows for better reach or multiple entry points. But I think that's why I would just emphasize the importance of our recommendation to the Joint Executive Committee to look across these programs, really understand the different touch points when they're happening and be deliberate about that and look for their effectiveness so that we're avoiding any areas or concentrating them in areas when it's just adding to the confusion.
And knowing what you know about the I would say, labyrinth of people in charge of TAP and the limitations that Ms. Ortega has. If you were in her shoes, what would you do right now to implement some of GAO's recommendations?
I mean, the first thing I would do is look to DHA and look to their leadership to hold the transition program accountable. There's very little oversight of the In Transition program right now that is run by contractors. They have no performance goals. There are no metrics. We heard from the officials themselves that the program is working as intended, which is very troubling. So I think there needs to be leadership within DHA that is monitoring this program and holding the contractor accountable for specific goals, outreaching, getting to those individuals earlier in the transition process, and ensuring they're getting that touch point so that the eligible individuals have a chance to participate in this important resource.
Ms. Hundrup, that seems like an extremely reasonable plan. Ms. Ortega, will you commit to following up in that manner? And if so, how long will it take you, and when can we follow up with you about it?
Thank you very much. And I appreciate the GAO's recommendation. While we may not agree on all of the components of it, the expertise...
It's pretty simple, yes or no. Will you commit to following up in the manner just prescribed by Ms. Hundrup?
Yes, I will.
And how long will it take you, and when will you follow up with us?
So I will follow up at the beginning of the next fiscal year cycle.
Okay, you'll commit to that, and
Yes,
staff
sir.
will take that back, and we'll follow up with DOD, and we appreciate you continuing to work with us. Definitely Solid Start's working better. It's still not perfect. I'm running short on time, so I'll just make a couple points. VA issued a proposed rule for implementation of the Veteran and Spouse Transitional Assistance Grant Program. That's pretty important to us. Now that VA has funding in hand, when do you expect to open the grant application?
Thank you for the question. The Notice of Funding Opportunity has concluded on August 23rd. We have selected 13 organizations, and we are working on that announcement for release.
We will provide more details in terms of the additional resources that are, if you're asking if they're needed to address mental health. Certainly, I'll take that for the record and can provide a follow-up.
Okay, thank you. Chairman, I yield back.
The gentlelady yields back. The chair now recognizes Mr. McGarvey for 5 minutes.
Thank you, Mr. Chairman. And because votes have been